Okay, Charlotte, how do you think you went with that subjective examination?
I think it went quite well. I think I forgot a few questions, but I might be able to ask him again. But I think generally it went all right.
Yeah. What questions would they be that you think you missed?
The big one, I forgot to ask what his goals were for being
good
in rehab. But I think I can sort of, it's sort of implied that he just would like to get back to how he was before. Didn't seem too impressed with being unwell, which is fair enough. And he seems quite active and independent at home. So,
do you think it's important though to clarify his
definitely,
goals?
definitely, yeah.
Good. Is there anything else that you think you might have missed?
I didn't ask him about medications and how he's taking them and if he's taking them regularly and that, or if he'd had any before he came into hospital.
Did you get some of that information from the history beforehand?
Yeah, I did. Yeah, he does have some Ventolin and also he was on some antibiotics for his pneumonia.
Good.
But just to see how he feels about taking his medications.
One question about his pre-morbid mobility.
Yep.
Do you think you've got a clear picture of what he was like before?
I probably could have asked more about sort of the intensity and the duration of his activities.
Yeah.
Didn't really go into much detail there.
Yeah.
So, like how far he can walk or how long he can walk for.
Yeah, excellent. And also maybe any hobbies or interests?
Yeah.
Yeah. Yeah, otherwise that's very good.
Thanks.
So you asked Frank about having any falls and he said that he hadn't. But someone like him that's been in hospital for a while, what other things might you need to assess? What other things might have happened to them?
Well, if he's had, a bit of bed rest and he's usually quite active, he might have become a bit deconditioned.
Yeah, good.
So he might have a decreased lower limb strength that might sort of provoke some problems with his balance.
Good. So can you incorporate that into your objective assessment if needed?
Maybe assess his strength, his global strength.
Good.
And maybe also his balance to see how it's going.
Yeah. And what sort of tests do you think would be appropriate for someone like him, from what you've seen of him walking into here? What type of balance test?
Maybe a timed up and go.
Yeah.
So incorporate some sort of practical bit into it and maybe try a CTSIB.
Yeah. Good. Yeah. Any reason why you'd choose those ones?
Timed up and go because he seems generally that he's usually quite active, to see if he can get that sit to stand and stand to sit going well. Also maybe just pick a pen up off the ground to see if he can do that, so if he's safe at home if something falls. So
good. And the CTSIB?
Generally because it's a nice objective sort of measure, so if he had one done at admission to see if there's been an improvement.
And it also helps to look at different aspects of balance so that you might be able to find if there's a specific area that might be affected. Good. Do you have a bit of a plan of what you might like to assess objectively?
Yep. I'll maybe have a look at his oxygen saturation to see how that's going, and then have a bit of a listen to his chest. Get him to cough, see what his cough's like, if he produces anything. His thoracic expansion, and then maybe have a see how he is with his transfers, and then maybe go for a walk. So do a 6-minute walk test or something to see how his endurance is going.
Yeah, good.
And then if he's quite good, maybe try him on some stairs.
Yeah.
So, yeah.
Okay, good.